Hello, Calaveras County, and welcome to another edition of Mondo Calaveras. I'm your host, Mike Taylor. Now, usually we try and have a lot of fun on this show, or at least figure out other ways to have fun in Calaveras County. But for this edition, I wanted to talk to somebody who can help answer a lot of questions that I'm sure a lot of us are going to have, especially as we're coming up to Election Day. My guest this edition of Mondo Calaveras is Dr. Randy Smart, the Executive Director of the Mark Twain Healthcare District. Dr. Smart, welcome.
Hi, Mike. Thank you so much. It's great to be here with you.
You bet. Now, we have something coming up on the ballot in June called Measure A in Calaveras County that has to do with Mark Twain Medical Center. And before we even get to talking about that, how did we end up with a hospital in San Andreas?
Well, you know, it's a fascinating history. Our hospital history actually goes back as far as 1858 and the gold rush.
Wow.
And I'm not going to go quite that far back. But we basically had a crisis in Calaveras at about 1946, and our old hospital was condemned, and we needed a new hospital. And so in 1946, the voters in Calaveras established the Mark Twain Hospital District, now the Healthcare District.
Okay.
And so the district I represent today was established in 1946, and we had a mandate really from the voters to provide a hospital and hospital care.
Okay.
So we did exactly that, and in 1951 we built the Mark Twain Hospital. Now, that Mark Twain Hospital was really a showplace for the county. It was one of the most modern hospitals in Northern California. Mm. It was a place where treated both public and private patients. That was new. And there were parades, there were receptions, there were volunteers. And so that Mark Twain Hospital served us. We built it, we paid for it, and it served us for years and years until the 1970s, 1980s. Mm-hmm. And then it had a financial problem based on government reimbursement, and it almost went bankrupt and almost closed. There was talk of closure. So in the late 1980s, the healthcare district negotiated an affiliation with St. Joseph's Hospital in Stockton, mm-hmm. and that was consummated in 1990. It was a 30-year lease, and it's a 30-year lease that is still in place today. That lease will expire next year, 2019, and the reason we're looking at Measure A is because we need a new tenant or a new operational plan for the hospital.
And it sounds like basically a new sort of direction from the community, from voters. How do we want to proceed? Is that?
I think that's true. That's not exactly what Measure A is about, but it's an important message we need to get out. What Measure A is about is as we explored this, you know, what can we do in 2019? We looked at independence, we looked at other affiliations with Adventist Health, with Sutter Health, with Kaiser Health, and we ultimately negotiated with Dignity Health and negotiated what I think is a lease and an agreement that just provides a great healthcare opportunity for Calaveras. And so the reason we have a Measure A is because the public owns the hospital. The public built it, the public paid for it, and today Calaveras owns Mark Twain Hospital. And so because it's a publicly owned hospital by the voters, you have to have voter approval to either lease it, sell it, whatever you do.
Okay.
And so that's how Measure A came to be. So we need public approval to do whatever we do with the hospital, and that's Measure A is the lease that we're presenting to the public.
And basically, if my memory recalls, just to get it out of the way at the onset here, the Measure A basically asks, can the healthcare district lease the hospital to Dignity Health?
Yes.
That is
shall the healthcare district.
Shall the, yes. And so it's a yes or no question. You mentioned something quickly, and it's the thing that pops to my mind the minute I ever hear us talking about the hospital and the fact that the county, its residents basically own it. Why can't we run it ourselves?
Well, we did run it ourselves from 1951 to 1989. And we looked at that. There was really a strong public opinion asking that same question: why can't we run it ourselves? So we contracted with some consultants, some people that could really do healthcare analysis, healthcare business transactions. And basically they came back and said there's a couple problems with that. One is it's very expensive. And in order to even open the door, you're going to need about $30 million.
Oh, goodness.
We don't have $30 million.
No.
We have 1.6.
Okay.
As of today, right now.
Yeah.
And actually, if you look at good business management, you need more than 30 million. You need about 50, 60 million, because you want some cash on hand, and you want to make sure your payroll is sound, and you want to plan for contingencies. So they said the first problem is you can't afford it, it's too expensive. But the second problem is this is 2018, and healthcare in the nation and in the state is very unstable.
It's crazy.
It is crazy, and it's unpredictable. And they said nobody knows what healthcare is going to look like in the next 3 to 4 years. Nobody is going independent. Everybody is gathering together. And so what you see today is lots of consolidations. And we see them almost every week where healthcare groups are consolidating. Even non-healthcare people are starting to get into healthcare and consolidate. And insurance companies are starting to consolidate. And so they said two problems: you can't afford it, and number two, nobody else is doing this, and you're crazy if you even think about it.
Yeah.
So we really thought we gave it a good effort to explore that alternative, Mike, and I just don't I don't think we would really be doing the public a good service by even trying to go any further with that.
Are we fairly well self-directed in all of this? It sounds like it, but does the healthcare district have the authority to manage the hospital, or by contracting with Dignity, that's the entity that actually runs the hospital, and the healthcare district basically just becomes kind of a lessor?
Right, the healthcare district becomes the landlord.
Okay.
So the healthcare district, on behalf of the public, says, okay, we're going to lease this to you. And so what we lease is everything: the hospital, the 7 or 8 clinics affiliated with the hospital, all the specialists, the employees, the equipment. And in fact, since 1951, Mark Twain has become a healthcare system more than a hospital, because it has clinics in Arnold and Valley Springs and Copper, and it has a campus now that is several acres of healthcare. And so it's become a healthcare system, and when we talk to Dignity, we're talking about leasing that entire system. And the district would pretty much be in a landlord kind of role.
Okay. So you're not telling Dignity, run the hospital this way. It's basically, and this sounds like where the county and its voters and residents are, I guess, protected, for lack of a better word, is if the hospital fails, it's Dignity's problem.
It's all of our problem.
It'll be our problem too, obviously.
Financially,
but
it's Dignity's problem.
That's financially on the hook.
If it fails, Dignity pays for that.
Yeah.
But if it fails, it is a catastrophic failure for this county.
It would be huge.
Catastrophic. Because if you think about it, Mike, I mean, if that hospital fails and it closes, and you close the 7 or 8 clinics, you're also going to close some pharmacies.
Yeah.
And you're going to close some physical therapy practices, and you're going to close some private practices, and you're going to close some occupational health practices. And so the economic reach of healthcare is pretty broad.
Isn't the hospital the largest employer aside from government in the county?
The third largest.
Third, okay.
Education is the second.
Oh, I forgot all about education. Darn it.
But the hospital is the third largest. They have 324 employees. They have a payroll. And so when you look at Measure A and you look at the idea of leasing the hospital, you really have two fundamental issues in front of the voters. One is healthcare, and do you want healthcare in this county? But two is the economic impact of that. And do you want to create a recession by not approving Measure A? Do you want to create a really an economic catastrophe? And it's hard to assess what the impact of that would be, but and I'm not an economist, but I think it would be huge.
Well, it sounds like something to me that we would be a year, 2 years down the road thinking, uh-oh.
We've got a big problem.
We've got a big mistake. And it sounds like we would even be doing that if we were managing the entire system ourselves without Dignity's help. I mean, that sounds like, as soon as you mentioned $30 to $50 million, we know that Calaveras County government is going to be in a deficit next year, and the healthcare district,
and they're not going to have 30 to 50 million to lend to the healthcare district.
To and or lend. Yeah, that's true.
Neither is anybody else. So people have asked. We've done many town hall meetings. We've probably done 20 over the last year, all across the county. And we've probably talked to over 500 people, just informing them, just educating them about this. And we haven't encountered any resistance to Measure A, any cogent argument against it. So the people in this county really care about healthcare. They're really invested in healthcare.
Sure.
But part of the problem is we, as the healthcare institution, really have not kept them as well informed as we should have over the last 10 years.
Oh, okay.
And so going out and talking to them and educating them, I mean, I can't tell you how many times people say, really? I go, yeah, really. You own the hospital. So it's time to turn that corner, to say, look, as a healthcare district, we need to make sure you understand what healthcare is available, what the impact of that is, and what we want to do going forward. And we've had very warm receptions everywhere we've gone.
How has Dignity been through all this? I know that Dignity it took over the St. Joseph system, and so that kind of became our partner by default. How has Dignity been to work with in the past, and what does the new proposed agreement kind of look to do for the county?
So Dignity Health is a $16 billion corporation that specializes in urban hospitals. It's a little bit different than Mark Twain Healthcare District.
Yeah, that sounds like we're out of their usual bailiwick.
Right. So it's been a very interesting negotiation period for us. And we've had attorneys, not that there's been conflict, but you just need to have a legal understanding. We've had accountants, we've had operational consultants. And the negotiations were really very formative, very high value. And it's a little hard to go to that table with a lot of leverage as a small hospital without any money. And they've been very receptive. Now, there's things where they've said, not so fast, we're not sure we like that. But there's been other things that no other district has been able to accomplish that they've said, okay, we're willing to. I'll give you an example. The new governing board of the hospital will have 5 trustees on it. 4 of those will be Dignity Health. 1 of them will be from our district.
Oh, okay.
So that doesn't exist anywhere else in Dignity Health.
Oh, really?
Everywhere else, it's 5 Dignity Health trustees. But we have a representative on their governing board.
Okay.
And we have a community advisory board with community members that say, these are the services we need, this is the quality we expect. And those are things I feel really good about negotiating with them. And they understood. They said, we really like Calaveras. We like Mark Twain. We like what we've been able to do there. But I think it'll be a new day. the situation we're in now is sort of a hybrid situation where you have kind of half district, half Dignity Health.
Oh, okay.
It doesn't really work well. People blame each other.
I see.
It's not exactly a unified effort. I think that's the right way to say that. And in this new arrangement, it'll be 5 people that are all going in the same direction. It'll be very much a dignity operation, which is not a bad thing. The risk will no longer really be the counties. The risk will be the corporations and Dignity Healths. So I feel really good about what we were able to accomplish, and the proposal we have on the table. They're really required to maintain 25 beds at Mark Twain Hospital.
Okay.
They're not allowed to reduce the number of beds. They're not allowed to reduce the services.
Okay.
For example, we have nuclear medicine, physical therapy, orthopedics. They can't close those.
Okay.
By the term sheet we've negotiated, the only way they can close services is if they come to the district and say, could we close this because now it's 2030 and it doesn't make sense, and we could do it that way. So there's a lot of protections in there, Mike.
Okay. And this is another 30-year lease that measure
It is a 30-year lease. Technically, it's a 10-year lease with automatic renewals.
Automatic renewals. Okay.
Right, but it is a 30-year lease. Right, exactly.
As you were out and about talking with folks, what did you hear were some of their greatest concerns as this decision loomed?
Well, one of the biggest concerns is they said, wait a minute, this sounds too good to be true. What's the catch? What does it cost? How much am I going to have to pay? And people had a lot of financial concerns. Well, this deal provides this county, the healthcare district, with $12 million up front. We've never had $12 million. It provides continuous payroll for 30 years. It provides donations to the Mark Twain Foundation. So there's a lot of financial money coming into the county. And for the taxpayer, there's no tax burden. There is no additional taxes. There's no change in your tax bill. There's no financial obligation anybody has to do this. There's no financial risk. They simply say, sure, let's do it. We get the money, we put it back into the county, and the taxpayer is benefits 100%.
Has the district decided where that $12 million goes, or do you save that because you have to maintain the building and the premises in which Dignity is
So a little bit of both, Mike.
Okay.
A little bit of both. We want to be careful that if we need to do seismic upgrades or capital improvements, that we can do those. So we want to be smart with the money and just not spend it all.
Sure.
So we are going to set some aside for things we think are coming probably long after you and I are gone. But there will be $100,000 per month in lease revenue. And that is money we can turn back into healthcare. And we're so excited about that. I mean, there's so many things that we're talking about putting more behavioral health in Calaveras, so we have none. We're talking about building a clinic in Valley Springs. This county hasn't had a new clinic since 1980s sometime. We're talking about maybe some mobile vans that can reach the remote areas of the county, like Bear Valley, West Point, Railroad Flat, Burson, and provide health care. So we're really looking at ways to take that $100,000 a month, turn it right back to the county, and have a better healthcare system. And we're so excited about that. We're looking at some programs we think are going to be really popular and really high value. One is diabetic education. And we desperately need diabetic education in this county.
Yeah.
I mean,
as a diabetic, I will, and I count myself a little bit outside that box because, and correct me if I'm wrong, most of the diabetes education in this county that needs to take place is for folks that have type 2 diabetes. And most of the people who have diabetes have type 2 diabetes.
10 to 1, right.
And I happen to be in the type 1 category, which is insulin dependent for folks who don't know. But it is a disease that I detest the way the news media covers, because it's this horrible disease that's coming and attacking people. No, it's not. It's basically a disease that you can very easily control if you just pay some attention and listen to your doctor and your healthcare team.
Requires a lot of behavioral discipline.
It does.
A lot, and it requires good education and good support.
Yeah, that's where I turned the corner, and so I'm thrilled to hear that some education for diabetics is on that horizon if Measure A passes, because as soon as I was taught what I was taught in, I went to some classes that I called Diabetes 101, and it taught me from square one, here's what went wrong in your body, here's what happens when your blood sugar gets high, and here's how you deal with that. And once I got all that information, I was a new person.
Sure.
Because
you had control.
I had control.
You were no longer dependent on the healthcare system.
Yeah.
You said, I can do this, I can take control of this, I know what I need to do. That's huge.
Yeah, that's an incredibly powerful thing that I didn't even know I needed until I suddenly felt it.
Right.
So that's really good to hear that diabetes education is in that.
We're also looking at fall prevention programs because we're going to talk about it at a later date in one of my medical shows, but fall prevention is huge. And we can do a lot in this county to prevent it. Takes a little bit of resources, a little bit of seed money, but we can do that. We've helped fund a child advocacy program that is now down in Valley Springs. It's up and running.
Oh, so, yeah, it opened about a month or two ago.
About a month or two, yeah. And so what we try to look for are the gaps. And we say, okay, we don't need, the hospital's not a gap. Dignity Health is going to run that. The clinics are not a gap. So we look for the gaps and say, okay, what can we do? Who can we partner with? And how can we fill those gaps? And how can we take $100,000 a month and make this county feel really good about its health care?
Sure, and get healthier.
Yes, and get healthier. Exactly, yeah.
Now, I know as a public official on the Healthcare District Board, you can't say vote for this or don't vote for this. But what I want to ask is, if there happens to be a voter out there or folks out there who are thinking, well, this just sounds like we're throwing some future away. I can't quite make that connect in my head after what we've just talked. But someone who would come out against this, where do you begin your explanations to say, no, here's why it's a good idea?
Well, I don't think we're going to see a lot of that. But there is a mentality out there that comes in and says, I'm unhappy, therefore no on everything. No on him, no on her, no on Measure A, no on Measure B. And so there is that mentality out there. And what I tell them is if you vote no on Measure A, then we really are at risk for losing all the health care in this county and never getting it back.
You'll
never get it back.
Yeah.
And so if for now, you may say that's not a problem. I'll drive to Stockton or I'll drive to Sonora.
Yeah.
That'll be okay until you're about 80, 85.
And can't drive.
Which I'm pretty sure you're going to do because we know that people are going to live longer. And at about that age, you're going to wish you did have a hospital and you did have a place to go.
Yeah.
But so there is risk to voting no. And I don't think Measure A is in trouble. In fact, I know it's got tremendous support. But wouldn't it be a cool statement if like 90% of the voters in this county supported Measure A? Wouldn't that be just a strong, exciting statement to say we value our health care, we value our health care system, We endorse the healthcare board and what they're doing.
I was going to say, we value what the Healthcare District Board has done to study all this and to come to these conclusions.
Right, on behalf of the public.
On behalf of us, the voters.
And these healthcare board members, I'm the director, so I'm kind of employed, but the healthcare board members, they're volunteers. They all have jobs. I make them work hard. I think I irritate them a little bit, but I make them work hard because I have high expectations. And they're volunteers, and they are doing a tremendous job. But, you know, for Measure A to pass, we need 50% plus one.
Plus one.
Wouldn't it be great if we had numbers like 90%, 95%?
That would be something.
You know, wouldn't that be a great statement?
Well, and I would think that also it would give dignity a kind of a, we told you, because and I was also thinking that we do have an aging population in this county.
Absolutely.
The majority.
We're 10 years older than the rest of California. Yeah. Absolutely.
Yeah. Right. And so to not have a hospital, I would think would be, it's a bad choice of words, but I'm going to use it anyway because I'm Mike Taylor and I do that kind of stuff. But it would be the death knell for the county. Oh,
it would be. It would be catastrophic. There are areas of the United States now that are referred to as medical deserts.
Oh, man.
And medical deserts, I think they have a definition like you have to drive more than 2 hours to get any kind of health care.
Oh, my gosh.
And Calaveras County could become a medical desert. I mean, it absolutely could do that. And that's why I really think Measure A is only the start. We as a county have to support our hospital and its clinics. A lot of criticism. We've had some rough years in the past. You know, there's been some transitions, but right now there's a good team involved. They're making a lot of good progress. They're very committed. And we can't say, you know, my uncle had a bad experience in 2005, therefore I'm never going there again.
That's very true.
We just can't do that because if we do that, we won't have a healthcare system. And if we're doing something wrong in 2018, tell us and we'll fix it.
Yeah.
Right now, our emergency room patient satisfaction scores are nearly 100%.
Really?
Unheard of.
Wow, that
Absolutely unheard of.
That's amazing.
Right. But people get very opinionated about their health care. And we certainly need to understand the value of Measure A, but we need to do more. We need to say, okay, we're going to grow up a little bit and we're going to support our healthcare system. And if it's wrong, we're not going to abandon it. We're going to fix it.
Yeah, and contact the healthcare board.
Absolutely.
When something goes wrong.
Absolutely.
Now we're down to just a few seconds. If someone is asking the question and you can't say vote yes or no,
I'm not allowed legally to do that.
It sounds like the answer to almost any question is, do you want health care in the county?
That's what's at stake,
And
Mike.
if you don't, I'll say it so he doesn't have to. I think you might be kind of foolish because all of what we just talked about over this half hour has been, we need health care here. We all are going to have to use it at some point, and Measure A is coming, so be ready for it in June, ladies and gentlemen. Dr. Randy Smart, thank you so much for being here.
Thank you, Mike.
Folks, I am Mike Taylor. Join us next time on Mondo Calaveras, and until then, enjoy.